this
So
chair.
I'll tell you a little bit about my organization, Healthcare Justice North Carolina, before we get started. We have about 4,000 members here locally. As it was said before, we're the local chapter of Physicians for a National Health Program, and we are advocates for universal health care for everyone in the United States. We'll talk a little bit as we go through this about the health care in the United States. It's impossible to talk about medical debt without talking about why we have medical debt, and that's the way we manage health care in the United States. Just to break the ice a little bit and have people give me a show of hands, how many of you or your family members have worried about your ability to pay a medical bill in the last year or two? Show of hands. Sure. Yeah. How many of you ever skipped or delayed care due to a high deductible or copay or the cost of the visit? Also. How about, and this is a common one, and I've done it myself, is not fill a prescription because of cost. There you go. Yeah, it's striking the number of people who take that prescription from their doc, go right to the drugstore, and you know that I love the interaction with the person behind the counter where they go, do you know how much this will cost? So a lot of people just leave at that point. Finally, show of hands here, how many of you are content with the current status of the healthcare system in America? How many are happy with it? Okay, all right, so we have some things to talk about tonight. So we're going to talk about medical debt, which is an unfortunate byproduct of our healthcare system. We'll talk about the scope of the medical debt problem in America, who it affects, how it impacts their lives, and importantly, why medical debt is such a uniquely American problem. We don't see it in other wealthy nations. And we'll talk about a number of things that are uniquely American in this talk tonight. Then in the second part of the talk, Rebecca's going to tell you a bit about what our state is doing to alleviate medical debt and what individuals can do if they have medical debt or to stop from getting medical debt. And then lastly, I'm going to talk to you a little bit about the charity Undo Medical Debt and how you can support their mission. But first, I want to start with a personal story of a local Charlotte man and his experience with medical debt. You may have seen his story on NBC News last year, and he's actually here on our audience tonight, Mr. Terry Belk. Thank you for coming, sir. So I'm going to see if I can get this to work here.
I watched my wife die, and these people still came at me and her as she was dying for money we didn't have. Not saying we didn't owe it, but it should have been a better way to collect it than what they were doing. This is a national crisis. This is not just affecting North Carolina, this is nationwide. And hopefully this becomes a movement. My late wife was diagnosed with breast cancer in 2003. We had private health insurance, but it wasn't adequate to cover all the bills. So we were shocked a few months down the road, we get this big gigantic bill from the medical providers saying that we owed $23,000 that the insurance company didn't pay. About a month and a half, we get these letters and phone calls from their attorney threatening to take us to court, to sue us, put a judgment on us and all of that. She said, why are they doing this to us? To us, that's a lot of money, but to them, I'm sure it was pennies. And several months later, she subsequently passed. Fast forward, in 2010, I was diagnosed with prostate cancer. I had private health insurance there again, and it wasn't adequate to cover all the bills. I'm paying on the prostate cancer bill, and I am probably going to take this debt into the afterlife. The only way that this is going to stop if people speak up, speak out, and advocate for better. I'm in this because I lost the love of my life. And I feel her spirit with me every day, and I know that she wants me to stay in this fight, and I will.
that video, and I've watched it a number of times, a pretty simple thought goes through my mind, and it's, this isn't right. This just ain't right. This should not be the way we deliver health care in America, where somebody in the midst of suffering, illness, and loss is hounded for a medical debt they can't pay. Before I drill down on some of the statistics about medical debt, we're giving a presentation in a church here. I'd be remiss if I didn't zoom out and look at healthcare through the lens of our faith. We all know that Jesus' ministry was one of compassion and healing. Some call him the great physician. In fact, as Christians, most of us, I'm sure, believe that healthcare is a basic human right. The development of Western medicine and the church are linked early on in time. And Western medicine developed as an expression of Christian charity, and medical care played a big role in the growth of the early church. The Christian duty to care for the poor and the sick led to the earliest hospitals, and they were unique in their time back in the 3rd and 4th century, in that they offered care regardless of class or social status. The Methodist Church, in its social principles, advocates for health care for all in the United States without barriers such as medical debt. So it's clear that a healthcare system that would sue a patient for medical debt in the midst of suffering isn't one that follows the principles of our faith. Lastly, I want to introduce you to a concept you might not know about, and that's physician or healthcare provider moral injury. I'm sure you've heard about physician burnout or healthcare provider burnout. Long hours, stress, electronic medical records all contribute to physicians leaving their careers early because of the stress. That's not what moral injury is. Moral injury is what providers suffer when we can't do what we know is right for our patients due to issues beyond our control, like insurance coverage or medical debt. Let me give you an example. At least once or twice a year when I was practicing, I'd have a patient in front of me who I knew needed urgent specialty care. Sometimes they might be hemorrhaging in the back of their eyes due to diabetes. Other times they might need an advanced imaging study like an MRI or something like that. And I'd tell my nurse to schedule them for that study or arrange an appointment with the specialist. And she would come back to the room and say, they can't be seen because they have an outstanding balance at that physician's office. So that's moral injury. When you know what's right for your patient, you know what should be done for your patient, but you can't do it because of outstanding medical debt that they have with that clinic or with the radiology group. And that wears on a provider over time, and it's yet another reason why healthcare providers are leaving healthcare. So let's dig into the statistics a little bit. About 100 million of us have medical debt, and we owe about $220 billion. One of the most important lines in this slide is down near the end, where half of adults can't pay a $500 medical bill without going into debt. So that's one of the reasons why medical debt is so pervasive in our country. North Carolina is one of the worst states in the country for medical debt. About 20% of North Carolina residents have medical debt, and you saw on the video that it's about 25% in communities of color. If you go into rural North Carolina, that number goes up to 40% of people with medical debt. So people of color, people who live in low-income areas, all have more medical debt. There are consequences to having medical debt. There are health consequences, physical and mental consequences. People will postpone health care due to cost. As I said, drug costs prevent about 20% of people from actually filling their prescriptions. They have difficulty paying their other bills, paying their mortgage, paying for education loans. And it causes 2/3 of bankruptcies in the United States. Medical debt is the largest cause of bankruptcy in the United States. It damages credit scores, and that has pervasive effects on your ability to get a mortgage or an automobile loan. We'll talk more about some federal policies that are trying to address putting medical debt on people's credit scores. So these personal sacrifices are listed in this chart here, and people do what people do. They cut back on food, clothing, other basics. They tap into their savings. They take on extra jobs. They delay buying a home or getting an education so they can pay off their medical debt. Back in 2023, Duke Law and the North Carolina Treasurer put out a report on a 5-year period where they looked at North Carolina hospitals suing patients in North Carolina. There were about 5,900 lawsuits during this 5-year period against 7,500 patients and families for about $57 million, about $16,000 on average per judgment. Now, hospitals are allowed to charge 8% interest for outstanding debt, so that's added to this as well. 5 hospitals in North Carolina made up 96% of those lawsuits, and Atrium Healthcare had 40% of that. And we'll talk about some of the things Atrium's done in the meantime since then to do better with their collections of medical debt and things like that. So Atrium has healed themselves a little bit. They ended aggressive debt collection practices in 2022. The reason I'm showing this slide, though, is not for those statistics. It's, again, to come back to the human element. I'm going to show you 3 quotes from people who had these judgments against them. You'll see anxiety and stress in the first one. Scared to even go to the doctor. We went through everything to get help on those bills, and they said no. It's shameful. If you look at where the people with medical debt live in Mecklenburg County or in the Charlotte area, I think people from Mecklenburg will recognize this demographic map. We call this the crescent and the wedge in Charlotte. Back in the 20th century, more so than now, but the way the demographics played out in the Charlotte area with regard to income and people of color were that people of color and folks with lower income tend to live in the crescent area, and the wedge, which is kind of right here where we are in South Charlotte and Myers Park area, were more wealthy white folks. Still, if you look at medical debt judgments between 2008 and 2022, most of those judgments took place in the crescent area. Majority people of color, census tracts, and people with lower income. Who has medical debt? Well, as I said, it's people of color, young adults, women, all more likely to borrow for health expenses. And most medical debt is usually hospital-incurred debt. It's more common in the South. It's more common in southern states that haven't expanded Medicaid yet. Folks with low income or people with poor health or a disability. We still have many uninsured people here in the United States, despite the Affordable Care Act. So the approximate 30 million uninsured. But more importantly, and you heard from Terry's story, importantly, he had insurance. So half of those folks with medical debt have health insurance. That really doesn't seem right. I want to talk about one particular group of folks who suffer from medical debt, and it's not a group you'd immediately think of. And these are women and families who've just had babies, right? Should be the most joyful time of life for these folks, and they get medical bill after medical bill. So about 12% of people with medical debt attribute it to pregnancy or childbirth. Having a baby doubles your risk of medical debt. Average $3,000 in medical bills for uncovered services, and I could go on. The ICU stay increases that as well. And parents do what parents do when they have that debt. They cut back on food and clothing and other essentials, delay buying a home, and delay education for doing nothing more than having babies. So let me show you another video clip, again from NBC News, about a family that suffered from medical debt.
Why do you have a spoon?
At nearly 2, Jessica Hurley's twin boys are as old as the debt that accompanied their births. The Springfield, Illinois toddlers arrived 2 months early, Kinzer naturally and Perry via emergency C-section, only to begin a harrowing weeks-long stay in the neonatal intensive care unit.
They were hooked up to machines, and multiple times they would turn blue in my arms and their hearts were essentially stopping.
So, your babies are in the NICU, you're dealing with this trauma, and then you start getting the bills.
And then they just kept coming. He's about to drive up.
A dental hygienist and career laborer, Jessica and her husband Jimmy have insurance through his union. These are all your bills.
Yes.
This one's for $5,200. This one's for $2,200.
Go sit at your table, guys.
But their plan caps out-of-pocket costs at $28,500 per calendar year. The twins were born in late December, resetting that cap on January 1st and leaving the couple on the hook to meet it twice. Their account balance topping $80,000 after insurance.
I do find that this comes as a surprise for patients.
Dr. Nora Becker, a health economist with the University of Michigan, says the Hurleys, who have 4 children total, were swept into a growing trend among middle-class American families who make too much money to qualify for Medicaid, relying on private, often employer-provided insurance with increasingly high deductibles. And while most Americans with insurance through their jobs pay around $3,600 out of pocket for childbirth-related costs, data analyzed by the Healthcare Cost Institute shows for about a quarter of those Americans, childbirth costs $5,000 or more.
This is how private health insurance works for everybody. It's just that low and middle income families are the ones who bear the brunt of it.
Her advice to families expecting: check your plan beforehand and consider switching to options with lower deductibles, even if the monthly premium is higher. And if you get hit with big bills, don't ignore them. Negotiate. Jessica did, and nearly 2 years later managed to whittle her family's debt down to roughly $11,500, more than a quarter of which they've paid.
And a quiet old lady who was whispering, hush.
The remaining debt prompting Jessica to avoid seeking treatment for postpartum depression, fearing more bills.
Financially, it's ruined us. And all that happened to me was I had babies. Izzy, go inside.
The cost of living hitting this family hard right from the start. Maggie Vespa. And
all I did was have babies. $83,000 in medical debt. Just trying to live their best life. They had health insurance. So let's zoom out for a minute and look at why do we have medical debt in America? Why are we unlike other wealthy industrialized nations? Why are we unique in this regard? Well, it's the elephant in the room. Our healthcare system is broken. There's no way around it. We're exceptional in many ways in healthcare. I was in healthcare for decades, and we excel at technology, innovation, cutting-edge therapeutics. We're the best in the world. But we're also exceptional in too many bad ways. Our system is fragmented, complicated, and costly for people. We're the only developed nation that doesn't have universal health care for everyone. We're the most expensive for health care by twofold, about $14,000 per person per year for health care in the United States. You'd think with that we'd have excellent outcomes, but we actually rank at or near the bottom for outcomes with infant mortality, maternal mortality, life expectancy. You can take all those horrible statistics and they're all worse for people of color. We do some odd things in the United States. We treat healthcare like a market commodity, like gasoline or eggs, like there's transparent pricing and you can competitively shop when you're having your heart attack and decide what the best ER to go to in the midst of your MI would be. And so healthcare doesn't work like a market commodity. We link healthcare to employment. So if you lose your job, you lose your healthcare. And we all know folks who have stayed in jobs just to keep their health care. They keep that job at Starbucks because it has health care rather than going out and opening their own coffee shop. So it forces employers to be in the healthcare business. Most employers don't want to be in the healthcare business, and it stifles entrepreneurism and small business growth in the United States. This oddball thing where we link healthcare to employment. We have about almost $5 trillion in healthcare spending in the United States, and 30% of that goes to insurance companies and intermediaries as profit and administrative costs. And then the last thing I'll say about healthcare in the United States is we do it differently than a lot of countries. We focus on disease treatment rather than disease prevention. In our healthcare education and the number of doctors we make each year, we don't have enough primary care physicians. We don't focus enough on disease prevention in the United States. So I don't have a lot of graphs in here, but I like this one. On the y-axis, we have healthcare system performance, and that can be things like access to care, health equity, and health outcomes. And then on the x-axis is how percentage of GDP that we spend on healthcare. And you can see we spend 18% of our GDP is spent on healthcare, and yet we rank at the bottom of healthcare system performance compared to other wealthy nations. So our system is not working. You were right not to raise your hands when I asked you if you thought it was. Insurance status of adults in the United States, certainly Affordable Care Act helped. It lowered the amount of people who were uninsured by about 50%, but it created a new class of people who are underinsured. So ACA health plans have high deductibles and co-pays. So right now, this is the latest data from the Commonwealth Fund. We have about 9% people in the United States who are uninsured right now. 12% have insurance, but they've experienced a coverage gap in the last year. You don't want a coverage gap in your insurance when you're going through treatment for a health condition, or if you have a chronic illness like diabetes. You can't afford a health coverage gap. I would see that routinely each year. Patients who could not, type 1 diabetes, couldn't get insulin because they had a lapse in their health insurance. Terrible. And then 23% is this class of underinsured folks with high deductibles. We're all familiar with the deductibles. You saw it in Jessica's story where she had her babies at the end of the year, so she meets that deductible, and then the new deductible starts the next year. It's perverse, isn't it? It's designed that way. We call it broken, but it's actually functioning just as it was designed. So, the reasons we have medical debt: lack of insurance or underinsurance, and that class of people are increasing. The cost of health care, half of adults say it's difficult to afford health care. Cost of prescription drugs, we've talked about. Lack of comprehensive coverage, high deductibles and premiums. Insurance denials of care is another big problem. And then our insurance and healthcare system is incredibly complex. So there are billing errors and insurance complexity. We have about 10 administrators for every physician in the United States. So here's a quiz. The Duke Hospital system has 1,000 beds, and they have 1,600 billing clerks to handle health insurance claims. So that's Duke Healthcare. University of Toronto, Canada, has universal health care. University of Toronto healthcare system has 1,272 beds, 1,272 beds. Okay. I'd like to hear how many billing clerks you think the University of Toronto healthcare system has. So how many would say they have 100 billing clerks? No? Okay. 50 billing clerks. 25. Less than 10. Right, 7. They got 7 people to do their insurance billing, the University of Toronto healthcare system, compared to 1,600 at Duke. something's wrong. This issue of underinsurance for working adults is becoming a real problem. So if you spend more than about 10% of your median income on your deductibles and copays and out-of-pockets, that's underinsurance. You are underinsured and paying too much for your health care. So in North Carolina, if you have a single-person policy, you're paying about 10.3% of your median income. If you have a family policy, you're up to about 12.3%. And that's why folks avoid medical care. Underinsured people have worsening health because it's a system designed to make you not want to spend that money. And then perversely, once you've paid that deductible, my patients would come in and like, give me 2 MRIs. My deductible's all paid up. It's insane. There's something called the affordability index that looks at if people can afford or have access to affordable quality health care, and only about 30% of adults in the United States say they have access to affordable quality health care. About 11% of those same folks have been unable to pay a recent bill. And this is increasing. So the affordability index of health care in the United States is getting worse. People can't afford health care. And of course, most notable increases in lack of affordability are Hispanic and Black adults in low-income households. So who's doing well?
Anyone? Anyone?
Any guesses as to who's doing well? Starts with an I, ends with insurance. Anyone? So, right. Pharma too. Starts with a P, ends with ARMA. So pharma. So it's the insurance companies. So national health care expenditures have increased in the last decade, but look at cumulative earnings of insurance companies. And this is because the way we pay for health care in the United States, we put shareholders' profits over patient care. They're just being for-profit companies. They're doing what they do. They're for-profit companies. They're making a profit for their shareholders. So let's pivot for a moment and talk about something that's a little more uplifting, about some solutions for this problem. I'm going to talk about some federal policies and a little bit about hospital systems, then Rebecca's going to take over. Let's first follow how a medical bill becomes a medical debt. You'd think it's obvious, but it's got some important issues. So Jesse visits Health R Us, has a medical expense that's not paid for by Jesse's insurance, doesn't have the money to pay Health R Us, and so ends up with a bill that's past due. And that goes, so that billing then goes either from the hospital keeps pursuing that medical debt, or the hospital uses a debt collector. So at this point, the person has bad debt. The hospital system can either sell that debt to a debt buyer, and typically that's for about a penny on the dollar, and then that debt buyer will seek payment, or Health R Us hospital will continue to seek payment directly, or through a debt collector, or they'll just warehouse the bad debt. The problem is that this debt will then eventually end up on your credit report. So once Health R Us or the debt collector reports them to one of the credit reporting agencies, you have 180 days until that ends up on your credit report. And the important thing to know is that medical debt isn't like other debt. It really, it doesn't indicate a person's credit worthiness like credit card debt or personal loan debt. This is debt that people get through emergencies or hospitalizations or surgeries that they need. So you really can't plan for it. You can't plan for, your next heart attack or appendicitis. So it really doesn't indicate a person's credit worthiness. So in our opinion, it doesn't belong on a credit report that's going to interfere with your ability to get a mortgage or take out an automobile loan. So the government recognized that, and the Consumer Finance Protection Bureau had a rule that was supposed to become active in January that would prevent lenders from putting medical debt on credit reports. In the current administration, of course, with the restructuring of the CFPB, that's on hold, and we don't know exactly what's going to happen with that. 2022, we had the No Surprises Act that protects patients against unexpected out-of-network bills. This would be the situation. You go to an ER, the ER is at a hospital, it's in your network, but the doctor you see in the ER works for an ER group that's not in your network. So you get what's called a balance bill because that doc was not in your network, or the radiologist who read your chest x-ray was not in the network. So they're not allowed to do that anymore. And that was surprise medical billing. Also, air ambulance use was in this bill, but not regular ambulances. Finally, Affordable Care Act said nonprofit hospitals are required to create and implement a written financial assistance policy. How good hospitals are at carrying that out or giving enough charity care is a matter of debate. I will say this, Atrium Healthcare has done some good things in the last few years. In September, when Terry's story came out, Atrium Health and their parent organization, Advocate Health, wiped out existing judgments and liens against patients. In 2022, they stopped reporting debt to credit agencies. So they have done some good things. What happened in the fall is they were shamed into wiping out judgments and liens against patients by a national news report. So at this point, I'm going to turn over the talk to my partner, Rebecca, here.
All right, thank you. Okay, I need to take a breath because every time we go through how messed up our healthcare system is, how much we are paying for healthcare for really bad health outcomes in a system that doesn't work for anyone and that, for patients, and that leads people in medical debt, I get infuriated. Because we deserve better than that, and every other developed country has figured out a way to do this, and the fact that we haven't, that one Commonwealth where we're the little outlier in the bottom there should infuriate every single person in this room and every single person in this country. Because we deserve better, and we have to decide as a country, not just on healthcare, but on a lot of things, what kind of country we want to be. Do we want to be a country that invests in its people? Because that's what I see healthcare as, an investment in our people that actually pays dividends left and right. And so that is where I'm starting from. North Carolina is the most expensive state in the entire country for healthcare, according to a recent Forbes article. So we have a system that does not work. People have insurance and are still facing medical debt, like Doug mentioned. It's absolute craziness how we do healthcare in this country. And it's infuriating. So my part is going to be talking about how we can mitigate the current messed up system we have to try and keep people from facing medical debt within the system and understand their rights a little bit more. Because, like Doug was saying, we have the No Surprises Act. I'm going to talk about this medical debt program that was passed. And according, with the ACA, hospitals had to show their financial assistance policies, but they're not great about doing any of these things. So the more we know what we should be expecting when we go to these places, and the more we can tell our friends and our family members and our community members about it, the better off we're going to be in protecting ourselves. And that's why I feel so passionate about people understanding what to do when they get medical bills. All the things that I'm going to be talking about, we have handouts with all of them on it. One is about the medical debt program that was passed by our DHHS department, and the other is just sort of tips for how to sort of navigate the system. So I'll start there. So how to protect yourself from medical debt. So during our 10 years of advocating for Medicaid expansion, which by the way took 10 years to just give people basic rights that the federal government was going to pay 90% of the tab for, one issue just kept coming up over and over again: medical debt. So many people facing medical debt. And like we heard in Terry's story, and like Doug reiterated, it's not just unfortunately people that are not insured, it's also that underinsured piece that we have. So some good news. In 2024, all 99 acute care hospitals in this state signed on to this really amazing, first in the country medical debt program that would impact, and the more people know and understand about their rights, the better, like I said. So this program has three basic parts: relieve existing medical debt for patients, prevent new medical debt for patients, protect patients from unfair debt collection practices. And like I said, all 99 acute care hospitals signed on to this program, and so this should be even the for-profit hospitals, and that's the big difference. Because in the past, only not-for-profit hospitals had to do things like offer financial assistance. But now it's all of the hospitals because they signed on. And basically, just a little FYI, we ended up giving them a bunch of money through something called state-directed payments. So they did get a carrot, and then in order to get that carrot, they had to sign on to this. But it's actually very exciting. So the first part is relieving medical debt for North Carolinians. So starting July 1st in this state, every single person who, on July 1st and after, who is enrolled in the Medicaid program will have their debt relieved going back to 2014. So anything they have out there will actually automatically be relieved. They're going to do that through a partnership with Undue Medical Debt, which you'll hear about more. They are a charitable group that basically buys up medical debt from hospitals and providers, and then instead of collecting on that debt, like you saw in Doug's little chart, they actually forgive it. And people get this amazing letter that's like, your medical debt was forgiven. And what I've been told is they all get these phone calls saying, is this a joke? Because people can't believe it's actually real. And why it's important that it's done through this third party is because if the hospitals forgive the debt, then the patients would owe a tax liability. But because it's being forgiven through this third party, they don't actually offer anything. So they're all working with Undue Medical Debt. Now, of course, it can't be as simple as all that, even with this group. And this is why I want people to know about this. It should be automatic, and in most cases it's going to be. But some people who are on Medicaid actually also have medical debt that they have a payment plan on, and a lot of those payment plans are done through a third party, like an Access One. And what I'm afraid of, and I brought this up with DHHS and Undue Medical Debt both, is that debt is held in a separate place than the debt that's owed to the hospital. And so that's going to be a little trickier for people to, for them to get to that money to forgive. So we're trying to figure out if there's something we can tell people who are currently enrolled in Medicaid to make sure that they actually get the full relief. So stay tuned, because we might have additional information to give out because of that. So also, hospitals relieve all medical debt considered, and this is next year, so next year, July 1st, 2026, there's going to be more relief. And that's going to be all medical debt considered uncollectible dating back to that same January 1st, 2014, for any North Carolina residents that are at or below 350% of the federal poverty level. Now, uncollectible means they're not in a payment plan, or they haven't been able to pay on that debt for about 2 years. Now, I hate this part because I think it should just all be erased, but that is what they agreed to. And again, patients will not have any tax liabilities from this debt relief, but that's not till next year. And unfortunately, until then, they'll still have to pay on it. Oops. The next part of this program is preventing medical debt and cutting red tape for people. So starting January of this year, every hospital had to create a plain language medical debt mitigation policy that is linked to their hospital homepage. And this will help cut red tape for eligible patients by establishing something called presumptive eligibility. So in the past, people had to do like onerous financial assistance, applications, and sometimes they still might. But what's supposed to be happening now, and this is why, again, we need to hear from people, because if they're not doing what they're supposed to be doing, we want to hear about it so we can report it. They're supposed to be asking people questions like, are you currently enrolled in SNAP? Are you currently enrolled in other public assistance programs? If you are, guess what? You automatically now, there's a presumption that you're going to get 100% financial assistance at these hospitals. And so that's one of the big things, is now there's extended ability for financial assistance. And these are just basically the bottom of what. So 100% discount if you have 200% federal poverty or below, a 75% discount if you're 200 to 250, and a 50% discount if you're in that 250 to 300. Now these are guidelines and they're the minimum, but some places like Advocate Health are actually offering 100% financial assistance for people who are 300%. So this is just a minimum, but like I said, for hospitals that are for-profit hospitals that we're not even giving this at all, this is a great start. Discounts must be applied to the amount the patient owes for uninsured individuals, or the amount owed by insured patients after insurance payments, excluding co-pays. Doug mentioned about the 8% interest rates. So now those interest rates on medical debt are capped at 3%. And by the way, everything I'm talking about in terms of medical debt is just hospital debt. This is not talking about provider debt, which is a separate piece, which is unfortunately not covered by this really great debt program. Beginning January 1st, 2025, payment plans, so this already happened, payment plans must be capped at 36 months, and monthly payments cannot exceed 5% of the total household income for people in that 200 to 300% range. And if the hospital does offer an alternative plan that exceeds 36 months, the amount collected from the patient, including the principal and interest, cannot exceed what would have been collected under that 36 months, 5-month income plan. Which is great, because before then, people were being forced into payment plans that they could not afford. And this is the attempt to try and mitigate that. And the last part is sort of curbing problematic medical debt practices for people. So you cannot sell debt to a third party for people with incomes up to 30% FPL unless it is for debt relief. So, that little thing, the little maze that you had, now, starting in July, they won't be able to sell that debt for people 300 and below to any of these debt buyers unless it's to relieve that debt. They can't sell debt to third parties before 120 days after the first bill has been sent. They can't take certain actions to collect medical debt, including garnishing state tax refunds or putting liens on people's homes. They can't report medical debt to a credit reporting agency, and that starts July 1st. And that's really important on the state level because of what we heard with Doug about the federal rule being on pause now. And, the reporting to the credit agency is where it really becomes problematic for people, because that involves, because people check their credit report for everything, even sometimes for employment now. And in fact, another amazing storyteller advocate that many of you might know, Penny Wingard, she actually owes medical debt, and she lost some jobs because they looked at her credit score and saw that she did not have a good credit score because she had the audacity to get sick with cancer and other illnesses and had debt because of it. So that is the program that was established by our DHHS. And like I said, we have those handouts which have all that information on it, so you'll be able to grab that on the way out, and we have it in English and in Spanish. And I will say with the medical debt relief program, not the first set of relief, which is anyone who's Medicaid eligible, but that second piece that will be available for immigrants and other undocumented folks who have medical debt, but are not on Medicaid, because Medicaid does not allow folks who are undocumented to get health coverage through it. So that's why we have that in Spanish. So now I just want to run through a couple tips for navigating medical bills in general, because like Doug mentioned, it's an incredibly complicated process, and people get overwhelmed by it. And it's very easy to get overwhelmed. How many of you have gotten the "this is not a bill"? Then why are you sending it to me? I mean, I don't understand this at all. And then you're like, well, what do I owe? And because of our incredibly complicated system, errors are made all of the time. Because we have so many payers and so many different rules that medical bills are usually very inaccurate, and we need to advocate for ourselves and our loved ones and pushing back. So that's my number one tip. Advocate for yourself, speak up, and ask questions. It is stressful being in a situation where you can't afford to pay a bill, especially when it's for your health. But you are your best advocate, So be sure to ask questions when you don't understand a bill, a charge, or a treatment. You call up that financial, department at the hospital and be like, I don't understand what this is. I don't believe I had this service. Please explain this to me. Make sure you have received the correct bill with your name, address, and an itemized list of charges. We wanted to get it so that that's the default, that they send you an itemized list so you can actually go through. Unfortunately, that's not where we're at right now, but you have a right to an itemized bill, and I would suggest absolutely to get one, because I will tell you, I'm guessing that 9 times out of 10, there is something on there that you did not have or that is exorbitantly overpriced, like a $40 ibuprofen, and you can actually fight back. Hospital bills, like I said, confusing, can have mistakes. And ask the billing department or the insurance company if something doesn't look right. Be wary of signing up for a medical credit card, or even putting any medical bills on a credit card. So things like Care Credit, they have deferred interest schemes, and a lot of people don't understand what that means. And what that means is, for a set amount of time, you will have interest free. But if you do not pay your bill off in that set amount of time, then once you hit that period is over, you will get interest on the full amount. And then after that, the interest rate is usually sky high, over 20%, okay? So putting any kind of medical bills on a credit card is one of the last things that you should do. You should try everything else first. You should try and set up a payment plan. But first, before you do that, you need to try and get that charge down. You heard at the end of that NBC video with the woman who had the kids in the NICU, she actually negotiated. Think about it. So much, there are a lot of people, debt that is not collectible on people. And then what do? They end up selling it to these debt buyers for pennies on the dollar, right? So most places are willing to take something rather than nothing. And so that's really, really important. The financial assistant. Federal law requires not-for-profit hospitals to offer free or discounted care, and like we know now, because all the hospitals signed on, it's all the hospitals. So even patients with health insurance can actually qualify. If you are in that income range, my friend Steve was just going through cancer treatment. He has insurance, and he went to Duke for care, and the out-of-pocket cost, because he has one of these high-deductible plans, as we have, and he could not afford the MRI, the imaging. It was thousands of dollars. It was adding up. And so he actually applied for financial assistance through Duke, and he got it. And they were able to wipe that out. And guess what? He was able to focus on healing and dealing with the very stressful cancer treatment that was chemo and radiation that he had to go through, and not have to worry about, oh my God, am I going to go bankrupt because of this as well? Wanted to bring attention to a really amazing organization called dollarfor.org. They help people actually go through the financial assistance application, and they will actually advocate for you with the hospitals. Okay, so this is a great resource that a lot of people don't know about, and they will help you do that. They have an eligibility tool, and they're absolutely fantastic. If you're uninsured, ask to be screened for financial assistance or public health insurance like Medicaid. As you know, we've recently expanded Medicaid. If they're not offering to screen you for that, ask them for it. Medicaid coverage is retroactive to 3 months, at least right now it is. This is one of the things that they're thinking about, that they're talking about cutting back on the federal level, which I'll talk a little bit more about in a minute. But as of right now, if you get Medicaid, it will pay your bills back 3 months. So it's a 90-day look-back period. And this is really important for people who have these really catastrophic things happen to them. Work out a payment plan directly with your provider or hospital. Negotiate to lower your bill. Tell the hospital you can't afford the bill and ask what Medicare normally pays as a way to figure out a lower price. Do not take no for an answer. Ask to speak to someone else or call back, because honestly, the system is so complicated. Depending on who you talk to, they can give you a different deal, depending on who you speak to. But if you get a lower and ask for a no interest plan to start off with, and if they agree to a reduced rate, get that in writing. You can also ask to get a settlement amount, which is asking the hospital what is the lowest amount they're willing to accept to settle that bill. That's what I was talking about before. They'd rather get something than nothing, and so if you have some money, you might as well ask. If you are uninsured, you have the right to ask for a good faith estimate before you get care. And this is what Doug was also talking about in terms of the No Surprises Act. This is part of that. And so providers are required to give you a good faith estimate. Unfortunately, this is only for uninsured folks. Although I will say this, UNC is actually now offering estimates to people. The UNC system is, without me even asking. They're actually offering it for any upcoming services, which I think is fantastic. So providers are required to give you a good faith estimate within 3 business days. Get a separate good faith estimate in writing for each doctor and healthcare facility. If your bill is $400 over the good faith estimate, you have the right to fight that bill. And like I said, and there's more links here, and those will be out on the handout. And then in certain cases, you're protected from out-of-network charges under the No Surprises Act. This is another thing. The No Surprises Act is law, but whether or not the hospitals are actually abiding by it, in most cases, I don't think they are. So basically it says if you are in an emergency room, but actually it's if you have surgeries as well, and say your anesthesiologist is out of network, they are required to actually do in-network for things like that, if you are in an in-network facility. So and unfortunately, ground ambulances are not covered by the No Surprises Act, but air ambulances are. Read over financial documents thoroughly before signing anything. There are not-for-profit legal aid groups. You have Legal Aid, the Justice Center, Charlotte Center for Legal Advocacy, Pisgah Legal Services. I would try to have someone read anything over before you sign it, if you're unsure at all, okay? Because they will try to get you to waive your rights, as Terry knows too well. And that is something you don't want to do, because once you have that contract, it's much harder to go back. Watch out for scams that claim to settle your debt if you pay money up front or offer guarantees to settle debt. Again, just reach out to a trusted not-for-profit financial counselor. There's so many scams out there when it comes to healthcare, because there's so much money in the system that you don't want to actually make things worse for yourself. And then there's a toolkit that just has a lot of information about different scenarios. But again, these are all Band-Aids, everyone. These are all Band-Aids. It's the system itself that is not set up to actually center patient care, wellness, prevention. Instead, we have a system that is focused on profit. And until we can change that, we're never going to have the system we deserve, and that is actually going to be a better investment for us in our country. So we are committed at the Justice Center to pushing for additional medical debt protections, and we need your help. We're working on that on the state level some this year. There's some interesting bills out there. There's a bill that's trying to work on prior authorizations, because we know they leads to delays and denials of care. So that's out there. There's a lowering healthcare cost bill, and there's some other interesting things that we are working on. We're always looking for stories, because personal stories, as you saw with Terry's story, I mean, how can anyone watch that and not want to take action? And look, I mean, after all this time, Terry's bravery and speaking up ended up shaming Advocate Health into doing the right thing. And not only did they, forgive liens in North Carolina, they actually forgave all of these judgments in all the states that they have health care. And then the other thing that happened was the other hospitals that had these judgments out on people, they followed suit. And so that, I know. And Terry and I have talked about this. They want us to think that the shame is on the individual. But the system is what's shameful. And speaking out against it and showing that we're all in this together is actually how we break through. So the last thing I wanted to say is, I'm sure you've been following the news. Medicaid expansion, one of the best things to happen in North Carolina after 10 years. It's just been a little over a year, and we have over 650,000 North Carolinians in every single county in the state who have been able to get comprehensive, affordable health care, where copays are no more than $4. It covers mental health, substance use disorder, dental, vision, hearing, primary care, preventative care, and we were worried that it was going to be under attack. We're hearing now, because of pressure from people like you in this room, that some of the more egregious cuts that they were talking about, they've actually pushed back. That is the power of people. They want us to forget that. Civic engagement is so important. We need to continue. The things that they are pushing out there, one of the things in the new plan, it just came out today, instead of that 90-day look back like I was telling you about, I mean, isn't that wonderful? You have an emergency, you get Medicaid, they look back and you're like, okay, 90 days. They want to cut that to 30 days. Why would you do that? They have a safe staffing rule for nursing homes and long-term care facilities where they require like safe staffing. They want to roll that back because why would people in nursing homes actually need staff there? It's crazy what they want to do. So they still need to hear from us, and it's really, really important. The last thing I'll say is just 2 weeks ago, the new Medicare for All bills or the universal single-payer health care bills were just reintroduced. Your Congresswoman Alma Adams and my Congresswoman Valerie Foushee were the only two Democrats and the only two Congress people in North Carolina to sign on as co-sponsors, but at least there's that. And some people might say, well, it's just we're so far from that. Right? It's a pipe dream to think that we can change our healthcare system. Well, I want to quote Nelson Mandela. It only seems impossible until it is done. And now, when it seems the most impossible, is when we need to organize and change people's hearts and minds about what we deserve as a people and how healthcare is an investment in our country, an investment in our people. This is exactly when we need to be organizing, because I will tell you, our healthcare system is on the verge of collapse. I really believe that. It's not working. And when it finally does collapse, I don't want it to happen in a vacuum where the voices of people who are advocating for real solutions and not tweaks around the edges are not at the table. We need to prepare so that we can show up and say, we're not okay with tweaks around the edges. We want a healthcare system that works for everybody in this country, and we want healthcare as a right and an investment in our people. And I will turn it back over to Doug.
Wow, I don't know I can match that passion. So you're back to the old dude with just 2 more slides. Wonderful. Thank you so much. On each of your chairs, you'll see a small form of the QR code for a charitable organization called Undo Medical Debt. It used to be called RIP Medical Debt, and they changed the name a year or 2 ago. Founded about a decade ago by 2 debt collectors who saw a new way to help people who were suffering from medical debt. It was a simple idea. Buy up large bundles of delinquent medical debt, and instead of trying to collect on it, relieve it for pennies on the dollar. Generally, they're able to buy about $100 of medical debt for a penny. This organization has partnered with 300 hospitals and 20 governments to date and eliminated $15 billion in medical debt. There's no application process for people to have their debt relieved. They just get a letter in the mail announcing that their debt has been relieved. So if that speaks to you, please scan the QR code and consider giving to this really terrific organization.